Test, test. Oh, yes, it's working. And where's my friend Tim? Is he up there? Tim, are we close to ready to go here? I think it's time to introduce our contestants. On one team, we have Dr. Flugard and Dr. Killian, and a round of applause for taking the stage. Dr. Thorgard paired with the former McFarland president, Dr. Bannett, father of my medical school classmate, Peter. And we've got Dr. Smith paired with Dr. Partridge, the surgeons. Well, at least a surgeon team. Dr. Holberg is at the National Animal Disease Lab, will be late. I've got a screen here. Do I have a screen in the background? Tim, are you there? Yes, we do. Okay, so I have to tell my one quick Alex Trebek story. It's not a Jeopardy story exactly. It's a story of a stupid TV show called High Rollers. Anybody remember that? Anybody my age, home from school sick? Yes, you remember High Rollers. So there was this stupid thing on the show where you rolled dice, and there was this deal where you'd get kicked. You'd lose if you rolled a certain number, and you'd get this insurance policy if you rolled another number. And Alex Trebek would say, as the contestant rolled the dice, if they rolled a number that got them both the insurance card and lost them a turn, he would say, I give with my left hand and I take with my right hand, right? So my oldest best friend's this guy, Tom Bellin, and he's a statistics professor at UCLA. His wife is a woman named Ann Coleman. Is Nick here? Nick Hamouche? We have an ophthalmologist. More on that later. But Nick Hamouche trained under Tom's wife, Ann Coleman, the head of glaucoma at UCLA. Ann is friends with Alex Trebek. Or actually Alex Trebek's wife. So Ann and Alex Trebek's wife, I don't even know her name, they're friends. Tom is at a dinner party sitting next to Alex Trebek. So Tom is asked by Alex Trebek himself to pass the salt or something, and Tom says, I give with my left hand and I take with my right. This is like something we used to do trading baseball cards. It was kind of a thing in my neighborhood as a kid growing up. And Alex Trebek said, and I think I'm quoting accurately here, huh? And he had no recollection of this silly thing. And so anyway, that's my Alex Trebek story. So without further ado, I am going to let the games begin. And we did not draw or anything, but I think our senior statesman, Dr. Bannett, will begin. Now, there's a button I'm supposed to hold down, and you can't answer until I've read the question or some such thing. I think it's the mouse button. Tim, are you out there somewhere? Tim, before I go on, let me offer up some gratitude for some relevant parties. Dr. Arbalou, there, yeah, so the button is just the left mouse button? Okay, so I'm glad you're here. Dr. Arbalou, and we are using some of his questions. Dr. Taylor was kind enough to create some medical aeronautic, and great, so fancy, medical aeronautic and scuba questions that were like, I'm a pilot, I didn't know the aeronautic stuff. It was like, what plane did the guy who wrote The Little Prince get shot down in? And if anybody knows, Brad? No, it was a P-38. So thank you anyway, Dr. Taylor. And Tim Holkstra, who you just saw, has been fabulous in the production of this event. Doug Whitrick helped with the questions. Diarlis thank you, Diarlis, up there, underappreciated. Amber Deerdorf had helped us, and we got some other questions from somebody, and that's lost to time. So thank you, anonymous person who helped, I believe, with epic questions. So I've introduced the contestants, and I think I'm the guy that clicks on the category once you pick, and then I think I hit the button when you can answer the question. Tim, are you still out there? Tim? I've forgotten. Do I hold the button down? They can click. You're going to click on the categories. I hold the button down when they can answer. They can't answer until so you're going to be clicking away until I hold down the button. Dr. Bannett, would you like to begin this journey? Our categories are radiology, hip oy vey, about hip fractures, Como se dice? A little medical Spanish, and sorry for my off-color comment on that. You'll see what I'm talking about. This treats what? Name that drug, and this is epic. Dr. Bannett. Hip hip oy vey for 100, sir? Yes. Sometimes I'm waxed, sometimes I'm wet. I'm a big cause of falls, an avoidable threat. And Dr. Thorgard and Bannett. Slippery floors is what we were looking for. Excellent. And you guys get to pick the next category. That was the answer. Whoa. We're out of control here. We're getting back in control. I only have the one button, right? So how badly could I have screwed that up? Reloading. It's a hard job up there, what Tim is doing. I was thrilled to find out I'm not the guy who clicks the category. Anybody, were you going to go for hip hip oy vey for 200? Oh, this is epic for 100, and the answer is workflow and navigator to use when discharging a patient from acute care to rehab or behavioral health. And Dr. Thorgard and Bannett. An epic specific thing. I didn't write this question, so I apologize if that's necessary. But do you want to give me an epic button? What is discharge readmit? All right, we'll give him credit. Who's keeping score?
No, that was wrong.
No, that's a different button.
That's
a different button.
that is a different button. You know what? I became an allergist to not deal with inpatient epics, so I am not sure entirely. I think Dr. Thorgard is eating the loss, and I think his score conveniently goes back to 0 because nobody's keeping track of the score, which is going to be cataclysmic, but that's okay. Dr. Killian, would you like to buzz in on that one? I think you sort of did. Yeah, so you said discharge readmit. Okay. I'll accept that. Sorry for my ignorance. And would you like to pick a category? Oh, yeah, it's good to have you down here. Somehow that reassures me. Okay, it works out well. So kill the hip hip oy vey for 100.
We'd like radiology, by the way, for 100.
Radiology for 100. And the answer is, these waves were discovered in 1895 by physicist William Röntgen. He used a cathode ray tube to create an unknown wave. And the first time from Dr. Smith and...
Could it be, Alex, what are X-rays?
What are X-rays is the correct answer. Well done. And somebody in the audience want to keep track of the scores, so we just make them up as we go. Oh, well done. Thank you for that. And pick a category. This treats what for 500, and it's a daily double.
Let's do a true daily double.
True daily double for 100. You catching that, Diarlis? And the answer is this drug is used to reverse benzodiazepines.
What is flumazenil? No.
I don't know. Funny you should ask, but I think that's right. Yes. And you know what? I got to tell you, I don't know the name of this thing, but I've always resented it because I had a better name for the drug. Like, why did they not call it Reversed, right? That would have been awesome. How obvious is that? The focus group said no, apparently. Yeah, and the next category is, and you guys, you doubled down for 2 on that, for our folks keeping track of the score. Pick a category.
This treats what for 400 hours?
This treats what? This drug helps regulate the production of glucose in the liver. Oh, sorry. Oh, yes, Dr. Killian. Yes, I think actually, strictly speaking, there are other answers to that, but that was the one somebody else was looking for when they wrote the question. So you get 400 for that, and pick a category. I forgot to press the button, so if you're all like getting cramps in your thumbs, just because the one duty I actually have here, I was neglectful, so forgive me. Category is, this treats what for 300, and the answer is, this drug is used to reverse opiates. And Dr. Killian, right there on the button. What is Narcan? Excellent. It is one of the alien drugs. You can squirt it down somebody's lungs. That I remember. So pick another. Yeah, see, Dr. Flugard knows.
This treats what for 200?
This is the place where a nuclear reactor melted down in the USSR in 1986. And Dr. Smith and what is Chernobyl is the answer we were looking for.
Treats what?
Yeah, I didn't write that question. I don't know what it's doing there, but,
Is it potassium iodide?
I'm sorry? Oh, that was from a different category. Well, that's going to be a little confusing. So, again, the one button I'm responsible for was not involved in that calamity. So, yeah, give him credit. I absolutely. And you also get to pick a category. 1,000,000 points for that. I don't remember. I think that's a radiology question, yeah. Which really, I don't think Dave Larson had anything to do with that or will have anything to do with Chernobyl, right? It's not his thing, but whatever. Pick a category for us, gentlemen.
No, they can still pick. Let's do 200 on name that drug.
Name that drug for 200, please. The answer is 400,000 Civil War soldiers became addicted to this drug. And the answer, Dr. Killian, Dr. Flugard, what is morphine? Yeah, they used a lot of it. It's kind of funny because different wars have different drugs that our soldiers get tangled with, but that is correct. And pick a category for us.
Name that drug for 500.
Name that drug for 500. This drug comes from pregnant mare's urine. And Dr. Thorgard and Dr. Bannett. What is Premarin? It's horse urine. Sounds delicious. Does not reduce heart attacks. I was told in medical school that it is like malpractice to not urge every woman over menopausal age to put people on this stuff. And Dean, what was her name? Aschenbrenner insisted that we all do that. She was wrong, just saying. Pick a category for us. I'm sorry? This treats what for 200? The answer is sulfonylureas treat this. And Dr. Killian? Diabetes or hyperglycemia, yeah, excellent. And you guys get to lead us now with a question or an answer. This treats what for 100? The answer is beta agonists commonly treat this. And Dr. Killian? That's wrong. No, that's right. Of course, that's right. Well done. $100 for that. Cash money. Name that drug for 400. The answer is there are 3 different inhibitors of cyclic GMP type 5 on the U.S. market today by brand name. They are. Oh, how ironic that Dr. Killian got this one. That seems so unfair. Dr. Killian.
There's only 3?
Well, 3 that I know of. The 3 main ones, right?
I thought there was more than 3.
Well, there are more than 3 brand names, and I'm looking for the brand names for this. Just throw me. I'll take 3. And I think we gotta probably buzz you guys. Really sorry about that. And I'm opening up. Anybody? Oh my goodness! What is Cialis, Viagra, and Levitra? They are. They are.
Super glad I didn't know that.
Yeah. And credit to the newlywed for not knowing the answer to that credit.
There's another one. There's Staxin.
Yeah, and then one of them they use for pulmonary hypertension. Sold under it is the same. There is 4. Oh God. Well, so I get a little credit for not knowing there were 4 of them, right? Must be one of the 3 of them is on my formulary, so I don't know. All right. Oh, so enough. Apologies. That question I'll take ownership of, and I'm really sorry. Pick another category. I think it was you guys that got to pick the last one, right?
I'll take the drug against 300.
7-Up originally contained this drug. Oh, sorry. You guys.
So we're going to say cocaine.
No, that's actually not accurate. Buzz in panel. Anybody? 7-Up is a clue. Dr. Thorgard? No. Even then, it was the Uncola, right? I mean, and do you guys want to take a stab at this? 7-Up? Anybody? Nobody married to a psychiatrist but me. The answer is lithium. Yeah. Who would have guessed? This is back at a time when you could have bought Dilaudid or Laudanum in the Sears catalog. So I think you guys picked that category, right?
We'll finish out the drug.
Finish off the drugs. Coca-Cola has this ingredient from around the early 1900s, and Dr. Thorgard, that would be cocaine. So we are ready for a category, Dr. Thorgard.
Let's try radiology for.
Radiology for 400. The answer is, this element is a very dense radiopaque contrast used in GI studies. Dr. Thorgard, barium is correct. And, okay, one last question. So you guys want to pick a question for us? Or an answer? Radiology for 500. The answer is, this imaging can be created by ordering this study. Oh, sorry.
Upper GI, small bowel follow-through?
Yeah, we'll take that. I think actually an ACBE or an air contrast barium enema. And that you'll notice the arrows are pointing to the proximal and distal side of what is referred to as an apple core lesion.
Thanks for taking that answer.
Yeah, that was kind of a lame answer, and apologies to the other contestants, but there aren't fabulous prizes. You're going to walk out of here empty-handed with the gratitude of the audience. So. And I think, lame answer, but we'll let you pick the category.
Okay, we'll take, this is Epic for 200.
This is Epic for 200. That was brave. Indicator of a patient's risk for readmission. Yeah. Dr. Partridge.
LASIK score? No?
Hell, I honestly don't know the answers. I looked at it, and it did not stick in my head. I think... that is right, yeah. No points, subtraction, addition, right? You with me, Diarlis? And Dr. Killian, you guys get to pick something.
You want to do radiology? Sure. Okay.
Radiology for 2, the answer is, this is the place where, we already did that. No, pick a different one. Radiology for 3. Yes. This is a radiograph view of a patella in which the patella is separated from the other bony structures, also morning's first light, and Dr. Killian and company, the answer is...
Sunrise.
Sunrise view, exactly right. And you guys get to pick our next category.
Okay, Spanish for 100.
Oh, this is my category. Open your mouth. Give us the Spanish for that. I'm sorry, I didn't press the button. My one job. Yes, abre la boca, you got it. That's exactly right. And you know what? I'll tell you, I go to Marshall's on every Tuesday, and my Spanish is totally lame. I irritate my middle child by occasionally when they say how many at a Mexican restaurant, I'll say tres or, dos or whatever. And she thinks that's incredibly humiliating to the whole family when I do that. And occasionally, my broken Spanish, my terrible Spanish, not even Spanish, I took a couple years in college, I suck. But, the patients really appreciate an effort, right? So that's all I'm saying. Next category.
Sure. Spanish? Okay, we're sticking with Spanish for 200.
Spanish for 200. Whoop, wrong category. That's not Spanish. Oh, yeah, all right. We'll skip that. That was alcohol. Yes, who would have guessed? Alcohol makes you break a hip. But according to UpToDate, and I got to throw this out there, up to 2 drinks a day, 14 drinks a week on average for a man reduces your risk of hip fracture. So that's unexpected, I thought. 0.77. Yeah, listen, speaking for myself, you do get up. You have to get up. Switch from beer to bourbon because I don't like getting up from the poker table as much. Anyway, that's Dr. Thorgard should get that. So, ¿Dónde está el dolor? The answer is Dr. Killian.
Where's the pain?
Where's the pain? And next category, Dr. Killian, Dr. Flugard, what do you like?
Keep going on this.
For 300, the question is, take a deep breath. And Dr. Thorgard and company, respira profunda. And the epic, or rather not epic, Google says respirar hondo, which means deep, but profundo means profound. So respirar profundo is what I say. But again, I don't speak Spanish. And you got to pick a category. Spanish for 400. Ciento tiempo has estado enferma. And the answer is,
You want to guess? All right. How many times have you died?
actually, I'm pretty loose as Alex Trebek goes, but I can't accept that. So, Dr. Thorgard and company. How long have you been sick or ill? That's correct. And then you get to pick the next category. This is epic. Hip hip oy vey for 300. The answer is percentage of falls in women, and we'll take this to the nearest. In other words, the percentage of fall victims that are female, and we'll take it to the nearest 5%. Yeah, Dr. Thorgard. 70% is exactly correct. That's very impressive. How do you know that? I mean, people don't. Oh, okay, all right. I'm less impressed. Count me less impressed and less observant. You guys get to pick the next category. Hip hip for 400. According to UpToDate, the percentage of people over 65 years of age who fall each year in the U.S. to the nearest 5%, and the answer.
70.
That is not close enough. And Dr. Thorgard and Dr. Bannock. That is actually in the range. UpToDate says 30 to 40%, so gold star. And yeah, you're good. You get points, right? Points. And now we'll take another category from you guys. Hip hip for 5. The answer is a fractured hip in this location. And
Subtrochanteric fracture.
Subtrochanteric fracture is exactly what we were looking for. Well done. And you get to pick a category.
Epic for 300, please.
And for 300, required before the admission orders can be signed. And
DNR order?
no.
Diagnosis?
And I think you guys are punching in. We'll let you answer. Geez, that's entirely possible. I didn't write the question, but I don't think that's what they were looking for. Do you guys want to throw something out there? I think that is what they were looking for. Can I see? Indicated an act. What is indicated? Indicate an active hospital problem. So points off, points for the middle, and you get to pick a category. Okay, now apologies for the question, right? It's a joke. Everybody lighten up. Realmente lo siento por el narcisista. Yo no voté por él. It could come in handy talking to our Latino population. Yes, Dr. Killian.
You're a narcissist. I didn't vote for you.
No, that's not correct. Anybody else want to guess? Dr. Partridge?
Eat me, I didn't vote for Trump.
No, that's closer. And don't make me ask poor Dr. Thorgard to answer this question. The answer is, I'm really sorry about the narcissist. I didn't vote for him. So it could be useful when talking to our, I should get points off. The host loses points for asking that silly question. And the last category, please. Report to view sensitivity percentages for organisms. And Dr. Thorgard, I don't think that's what they were looking for. You can find on Epic, apparently, somewhere, the sensitivities at our hospital, and I don't think that's, well, maybe it is. Let's see the answer. Antibiogram report. So I think no points for anybody, and let's not take points away from these guys. Well, so that was fun, huh? And we're ready for double Jeopardy. I think we will not pause to go to commercial because we're not sponsored by anybody. No money is changing hands during this. And Diarlis is busy tabulating scores. Is that what you were doing, Diarlis? Can I hear? Yeah, we got a whole other board to worry about. The fun is only starting here. You want to give us some scores, Diarlis? Very impressive. Very impressive. You guys it's neck and neck. This is really exciting. I am on the edge of my seat. You know what? I am going to fund this. We will pay you dollar for dollar every point. No, I'm not going to do that. We're ready for double Jeopardy, and I believe the ladies get the choice of category because they're behind, right? But not by much. So pick something out. Oh, yes, I will, of course. That's part of the deal. JC standards, these are Joint Commission standards. I didn't write those. Tick, tick, tick is about tick bites. Phobias, guess what that's about? Hey, hey, my is reference to my man Neil Young, and it's better to burn out than fade away. Dead rock stars. I'm not a doctor, but these are television doctors, or I should say media doctors. I think all television doctors. Infections and antibiotics, a category brought to you by Dr. Arbalou. So I'll be a little hurt if that's what everybody picks first, but that's okay. I'll get over it. Dr. Killian, Dr. Flugard, give us a category.
Okay,
Phobias for 200. Fear of light and sound. And Dr. Killian. Yes, we will accept that. Photophonophobia is hard to say after you've had a bourbon. And pick a category for us. Phobias for 400, and the answer is trypanophobia is fear of this.
Turkeys.
No, it's tympanic membranes. You have a fear of eardrums. No, it is not. That's wrong. It's not turkeys. It's not eardrums. It's trypanophobia. I kind of thought it sounded like fear of syphilis, but that's just me. Like trep and something or other. Yeah, right. So somebody else want to take a stab at this? Buzz in panel? No. Was that a legitimate guess? You just talked to your partner? No points off. It actually is. Answer is, what are fear of needles? So we all deal with patients who have this. There's a name for it. I don't know if that's really necessary, but pixels are cheap. Somebody knew that? Really? Very impressive. Boy, you're going to go to medical school, aren't you? Whose kid is this? Yeah, I thought so. You have a really smart mom. So we're ready for a new category. And I think the smart mom gets to pick it.
Okay, Joint Commission for 200.
Oh, you're brave. Joint Commission, the answer is the one medical staff required committee for every Joint Commission accredited hospital. And
Credentials committee?
that is not correct. Anybody else? That is the correct answer, believe it or not. You know, I worked on this reservation for a year where JCAHO came and reviewed us, and we had these committee meetings for hours and hours and hours, because you have to have all sorts of different documentation. And the very day that they had come, there was a horrible, I was, believe it or not, how scary is this? I was the ER doctor that day, and there was a horrible howl coming out of the parking lot. I ran to go provide assistance, and an ambulance had run over a dog. And so, and we were, the hippie doctors were all animal lovers. And so we're carting this dog around in a sheet, getting x-rays and stuff, while the Joint Commission people are going up and down the hallways with their clipboards. And we thought we were really clever. We were getting away with it, and they were digging our committee notes, which were mostly dry labbed. But what was funny is they finally did bust us. They walked in on the dog getting an x-ray. It turned out, even though the dog acted like he was dying, he broke a toe. And he became my dog. That was Bruce. And it turned out that they were all dog lovers, and we got record high rankings on the JCAHO at this rinky-dink little hospital in Arizona. So sorry about that story. And I think you guys get a pick, right?
Infections and antibiotics.
In infections and antibiotics for 200, the answer is, in the U.S., among people who report a penicillin allergy, this is the percentage that will actually test positive for a penicillin allergy. And the answer is?
Can we be within a range, or is that speed?
Yeah, you get a range.
All right, 10%.
Yeah, I think that's close enough. I think we will accept that answer. And actually, I think that is actually the answer. Arbalou is the one who created this, and I think he's right. But I will tell you, that is not what they taught at my allergy board's review. They say 80% test positive at the 2-year mark, 50% at the 5-year mark, and 20% at the 10-year mark. And I think Arbalou's right on this. I mean, I will tell you, if you've got other stuff to use, don't send me the penicillin testing kid who just had the rash 2 months ago. Give him a little time. We'll see them later. And the older they are, the less they freak out about the testing. Just saying. And you guys get to pick a category.
All right, and infections and antibiotics for 400.
Infections and antibiotics for 400. The answer is, when cellulitis is non-purulent, this is the most likely causative agent. And Dr. Thorgarden Bannett. Strep is correct. So staph oozes and weeps and is a blistery, bloody mess, and strep is bland, so just so you know. And you guys got to pick a category. Phobias for 600, and the answer is fear of cats. This is actually my cat, if anybody cares. That is Polly, and Dr. Thorgard. That is not correct. Should be correct. It's not correct. Anybody else want to try this? There are two answers. There are two names for this. How about you, kid? Do you know any of these? No. Doesn't know the cat. Knows the needle thing, doesn't know the cat thing. So the answer that I can remember, because I speak bad Spanish, gatophobia, because Spanish for cat, gato, right? So that makes sense. I told you I spoke just a few words. If you're an allergist, that's one of the important words to learn to speak. And then aruleophobia is the other one. And I forget who asked. I think you guys did. You want to pick another? Phobias for 800, the answer is FDR. This is my favorite question. FDR essentially said this is the only phobia. Dr. Thorgard. Thank you for that, incidentally. But what's the name of that? What is fear of fear is the essence of the question. Anybody? You'll hate yourself if you don't buzz in. Phobophobia. That is correct. I will give these guys credit for it. So there is such a word. I didn't make it up. And FDR, of course, the only thing we have to fear is fear itself. So pick a category for us, gentlemen. Phobia for 1,000. And the answer is a daily double. Jarlis, you want to give us some scores? Strictly speaking, we're supposed to add those numbers to the last round because that's actually where they are. So do that in your head. You say 400, 1,000, 400, 400. So you were at 20, 22, 23, and 19 at the end of the last round? So you can bet some or all.
We would like to bet 500, Alex.
500. And the answer is, when you are afraid of the panel here, you may have this. Actually, in the host, it's a fear of doctors. Do you know? Don't say. No. You'll recognize the Latin root. I'll give you a hint. We cause infections in people. Ask Arbalou. Use that word, apply it to the word phobia, and you're there.
Just a minute.
The stakes are so high.
Iatrophobia.
Iatrophobia is correct. Yeah, I gave them a big clue, so sorry about that, everybody else. But pick a category for us. Yeah, well, I wagered on them heavily going into this. That's not true, Lou. I wouldn't have bet against you.
I'm not a Dr. Butt for 200.
I'm not a Dr. Butt, MASH doctor, played by Alan Alda. Answer is?
Hawkeye Pierce.
Hawkeye Pierce. Yeah, if you were in my, 8th grade class, this is what you did on whatever Tuesday night or something, is watch that guy. Pick a category for us.
I'm not a Dr. Butt for 400.
For 400, more than 10 actors have played this doctor in this BBC series, and Dr. Killian.
Who is Doctor Who?
Yes, that's exactly right. That is exactly right. And pick a category for us. Yeah, you're a nerd, aren't you, Dr. Killian? Your mom is a nerd. Am I right about that? Yeah. Your mom may be a Time Lord. I'm a little worried about it. Please.
I'll go with the ticks for 200.
Ticks for 200, and the answer is a single dose of this antibiotic can be given when a tick is found engorged or present for 36 hours and treated within 3 days of exposure. Dr. Killian,
What is Dr. Sack?
that is correct for 200. And pick us a category.
Let's keep going with ticks for 400.
For 400, this rash appears days after the start of fevers and malaise with this disease. Dr. Thorgard, that is correct. So you can't necessarily wait. This is a pretty evil one as tick disease goes. We don't have much in Iowa, but and pick us a category. Ticks for 6, the answer is the name of this rash associated with Lyme disease.
A target rash. What is a target rash?
Oh, can you give me a nerdier answer, please?
What is a bullseye's rash?
Nah, we got a fancier name, and you guys know. Erythema migrans was the nerd answer I was looking for. So sorry about that. But there are a lot of target lesions. Actually, I got a target lesion
This was
story.
like women don't come to work day.
Yeah. I actually thought about acknowledging that at the start of this, but then I thought, I've already got the, narcissist president question in there, and that was just enough hippie liberal for anybody to want to put up with from one host. So, yes, it is. I'll skip work today, and I'm really glad my nurse, Tiff, who was back there, thank you for coming to work.
Coming to work
So we need a new category.
Okay, we're going to stick with ticks.
Ticks. Going to stick with a tick. Mark Taylor had this tick-borne illness.
What is ehrlichiosis?
That is correct for, I believe, 800, right? And incidentally, HIPAA alert, I asked Taylor's permission I didn't care for the guy. I mean, I like the guy. It's just I was not caring for his illness, so I don't think that's so much a HIPAA violation. It's just gossip. Pick us a category.
Tick, tick, tick for 1,000.
Tick, tick, tick for 1,000. The bite from this pictured tick is known to cause both a meat allergy and an allergy to the chemo agent cetuximab. Isn't that a hell of a question? Yes.
What is the Lone Star tick?
That is correct. Well done. So this is a weird thing, and I got to just take a moment because it's so weird. It's kind of interesting. You get, and the way this came up is they were getting bad cetuximab allergy, but only in the southern half of the country. So the drug monitors are like, well, that's weird. The only people allergic to this stuff are coming from, Texas and Alabama. I think it's a southeast United States. And then somebody tapped into the meat allergy. There's a glycoside called alpha-gal, which is short for alpha-galactosidase something or other. And when you get bit by this little bugger, you can develop a meat allergy. And another interesting feature of that meat allergy is it doesn't happen immediately. So you have your meat, and then 6 to 8 hours later, you start having anaphylaxis. And mercifully, we shouldn't see a lot of that here. So we need a new category.
I'm not a doctor for 600, please.
Not a doctor for 600. This actor played this character, and I would really like to get both the actor and the character, please. Come on. I bet the kid knows.
No, he's too young.
He's too young to know this.
This is old Star Trek.
Yeah, that's the only Star Trek in my world, but
Half credit?
Can I get half credit?
yeah.
Dr. Bones.
It is Bones, but you didn't buzz in, but you asked, so sorry about the awkwardness of that. It's DeForest Kelley playing Leonard McCoy, a.k.a. Bones. So we'll take Dr. Bones for half credit. Don't give him all the points. I couldn't tell you that. Boy, you can't turn on your TV set without seeing Sulu. That guy's everywhere.
You know why he was called Bones?
He's an orthopedic surgeon. I don't know.
When he got through his divorce, his wife left him with nothing but his bones.
Oh, is that true? I mean, that's part of the Gene Roddenberry mythology. I like it. Pretty much everything you need to know about theology in the world, you'll find on that show. So, new category, please.
Dr. 800.
The creation, and we're going to watch a little movie here because this is an awesome little clip. Dr. Salty sent this to me. Somebody sent it to him because it was subtitled in Arabic, which I thought was pretty funny. But I found the English version. Are you able to play that?
Well, sometimes doctors make mistakes. Anna, you need to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No.
It's a good answer.
Why don't you show me how your inhaler works?
Jerk.
The creation of TV's Dr. House was partly inspired by this fictional character, Dr. Killian. Sherlock Holmes, yes, his name is House, and then he lives on the same Baker Street or something, and the parallels go on, and it's not a show I watch because the medicine is unbelievably stupid. I mean, my God, the guy has like 2 patients a week. Like, I want your group practice, right? I mean, I saw an episode where he kidnapped a guy and tied him up to help him get over his phantom limb pain. It's like, you can't duct tape people to chairs. That's not, the patient care review committee will talk to you about that. He is
Tough on HR.
he is tough on HR. Yes, he is. Pick us a new category, please.
Whatever Hey Hey My is for 200.
Hey, hey, my. So you got to tell me what the rock star died of.
Oh, we got it. You did it. Yeah. Okay. HIV.
AIDS-related complications is correct. For Freddie Mercury, author of Bohemian Rhapsody, for extra points, anybody want to know where he was born?
I think he's from Iran.
No, he's actually Indian. And I lied about the extra points. So you don't lose anything, you didn't make anything. It's all in good fun. Oh my gosh, I got to scoot. Pick us a category. We're doing this speed fashion now. I'm going to shut up. Pick us a category, or whoever.
Doctor for 1,000.
TV doctor for 1,000. Jane Seymour played this frontier doctor from the mid-19th century in a TV show I never watched, Dr. Killian. Dr. Quinn, medicine woman, a.k.a. Michael or Mike. So give us a category.
Joint Commission 400.
Joint Commission for 400. Reappointment time frame for physicians initially appointed to the medical staff. Dr. Killian. 2 years is correct. And picks another category.
I did know that, Yarlis. I just
I have like a couple of former chiefs of staff up here. It's a little embarrassing, but category.
For 600.
600. The answer is time frame. Well, and the question is time frame for conducting face-to-face assessment of a patient who was put in restraints. We're going to disqualify the question. It is an hour, but that's worth knowing, right? And same category for 8.
Joint Commission for 800.
And the answer is this examination and documentation by a licensed practitioner must be performed no more than 30 days prior to admission and within 24 hours after admission. The answer is, Dr. Killian. Pre-op physical, history and physical, we'll accept that. And next category. For 1,000, the answer is the points of service where medication reconciliation must be conducted. And Dr. Killian and Dr. Flugard.
Any transition of care.
So transfer from ER to the floor to floor, so discharge.
I'm good with that. The answer that the author suggested was upon admission and at transfer. That's exactly right. So I'm good with it. Points. And next category.
Infections and antibiotics.
Infections, you're avoiding my rock star one. If patient has a proven penicillin allergy, this is the likelihood that they will go on and have an allergy to cephalosporins. And Dr. Partridge, Dr. Smith.
15%.
No, that's not right. And that is also not right. Yeah, that's closer. In fact, that's really close. We'll take that. And actually, interestingly, it's not the same antibody. So in the field of allergy, sorry to interrupt the game for a little medicine, but it turns out that you're not making the antibody that sticks to the penicillin is not the antibody that's going to stick to the cephalosporin. The essence of this is that atopic people develop more atopic disease. So give us another category. Still avoiding the rock stars. The recommended dose and duration of vancomycin PO for treatment of C. diff in most patients is, Dr. Killian.
I think it's 250 milligrams 4 times a day for 14 days. You could do 10 days. But
Yeah, that's not what Arbalou's looking for, but we're in a hurry, so we'll count that. It's 125 milligrams daily. In fact, you're wildly off, but that's okay. It's Arbalou, it's not me. But
that's not what I've been doing.
well, so
no points.
Ms. Holberg, here we're changing practice of medicine here in Grand Rounds. It's inspiring. So now you know better. Take it up with Ricardo. Pick a category.
Okay, we're going to go with the infections for 1,000.
And this is the correct management of Candida albicans and sputum in a patient who's been on antibiotics for pneumonia. And the answer is nothing is the answer we're looking for. Reassurance, do not do anything. And don't send them to poor Dr. Arbalou. We're stuck with rock stars for 4 or for whatever. So who was the rock star? What did he die of? Oh, come on, Brad.
Zappa.
Died of
Prostate cancer.
prostate cancer. That's exactly right. It's more aggressive in the younger folks, right?
Didn't have no drugs or allergy.
There you are. And a category, please? Well, 600. So this guy from Led Zeppelin, does that help at all? Anybody know what he died of? Oh, what do they die of? They die of aspiration pneumonia after they, aspirate their vomit. That's what he died of. So aspiration, asphyxiation, John Bonham, Led Zeppelin, Stairway to Heaven. For those of you too young, it's Stairway to Heaven, Led Zeppelin. You'll like it when you're older. 800. And he died in this aircraft. In this aircraft. And this is important to me because I actually own this airplane, not the one that crashed. It's in pretty bad shape. Dr. Thorgard. It is not a single-engine Cessna. It is a Beechcraft Bonanza. I'll let you all off the hook. And it was funny because I was just in Des Moines about a week ago to see Lyle Lovett, the country star for people that don't really like country music. And he was awesome at Hoyt Sherman. And he told about a time he was on the road, stopped in Clear Lake, Iowa. He's from Texas. Stops in Clear Lake, Iowa, and the waitress pouring his coffee says, "Welcome to Clear Lake, Iowa, home of Buddy Holly." He's like, no, not. He's from Texas. Buddy Holly is, but he did die in Clear Lake. But that, I guess, is his permanent home. And hey, my. Oh, we didn't pick. Oh, who answered the last one? I did. Who answered the one before that? You did. You get this. So can we have some scores, Diarlis? You guys have scored so many points. It's good.
Round theirs to like 10.
Make up a number, Diarlis. Nobody really cares.
Say like 36B.
Ooh. So, no, don't do that.
All right, we're going to go 3,000.
3,000, and the answer is, what did this dude die of? I'll spot you who that is. That's the irrepressible Keith Moon. And instead of playing the Jeopardy music, I will tell you what I learned about Keith Moon when I was researching these questions. He had a hobby with John Entwistle from The Who, right? Talking about my generation. So the hobby was blowing up toilets. And they started with cherry bombs, worked their way up to M80s, and eventually were blowing up toilets in hotels with sticks, I kid you not, of dynamite, which is really rude and not really something to be endorsed. And I'm not endorsing that. You have any idea what this guy died of?
I'm going to say hepatic failure.
That's, I'm afraid, not accurate. The answer is he died of this drug, clomethazole, and he had like a script for a whole... He died of liver failure from clomethazole. No, I think he died of asphyxiation. I was told, and it's in a book, that he died of an antabuse reaction, which is not true. So, Diarlis, can I hit you up for the final, if not made up scores, or at least the scores going into Final Jeopardy? All right. So, Final Jeopardy. I am going to let you guys select your choice. You don't even have paper. So, oh well, who organized this? I'm terrible. Yeah, get in your head how much you're going to wager, right? And the category is medical history. And this is a question I'm rather pleased with. This is an answerable question. This is not an impossible question like clomethazole. What the hell is that? So pick a number and tell me when you all are ready. And I'll spare you my best effort at singing the Jeopardy song. Oh, play the Jeopardy song. Yeah. All right. You know what? How are we going to do this? We'll just bluff our way through it. So the question is, the final Jeopardy question is, these three men all have this specific background in common. I won't tell you who the first and second one are, and then you're supposed to write down the answer, and you can all tell me, and I'll tell everybody if you're right. The guy on the far right, I feel like I got to tell you, that is Charles Mayo. Louis knew that. And we're going to pretend like you've written down the answer. Oh, thank you for that. Written down the answer. You're going to hold it up, and the answer. The ladies are like they have no idea who this is. So, ladies, we'll start with you. You can kill the music. How much did you guys decide to wager? $1, $100. And do you know what these guys had in common? And incidentally, that's Bashar Assad, who was maybe in the top 5 worst human beings still breathing. And that's a strong statement. That's Rand Paul. And those of us on the left are kind of rooting for Rand to, do the right thing. And that's, Charles Mayo from the Mayo Clinic. And you don't know what they had in common.
They all look like white guys to me.
They are all white guys. That's the specific background that they have in common. No, not specific enough. And then I think you guys had, 38. Did you bet all of it?
Yeah.
And what did you think they had in common? No, that's not right. They are all white guys who were not in the military. What are the chances of that, right? And Dr. Thorgard, I think you know the answer to this. They are all ophthalmologists. Who would have guessed? Thank you all for coming. A round of applause for our great contestants here, and for Tim for putting this together, and the other people that made this possible. Thank you, guys.